Welcome everybody to 6 Surefire Ways to Jumpstart Your Referrals in 2012. I'm Adam Bishop, CEO of TAG Home Care Marketing, and I'm joined here with Eric Crump, who you've heard on many great webinars in the past, our head coach here at TAG. We're very excited today to deliver this webinar. It's the first webinar of the year, and we have got 6 great ways to help you boost your referrals this year in 2012, and we're looking forward to getting started. For those of you who've been on our webinars in the past, TAG Home Care Marketing is specifically in the home care, hospice, and private duty space. We service over 3,000 home health, hospice, and private duty companies across the United States, Canada, and countries around the world. We're located in Nashville, Tennessee, and very excited here to be with you today to present this webinar. So we'll go ahead and get started. As we've talked about in the past in many webinars that I've done and Eric has done, we've talked about it never being a greater opportunity than it is today to start a robust sales and marketing program. Competition isn't going away, Medicare cuts aren't going away, and it's a more difficult time than ever to sell your agency's competitive differentiator to the marketplace. And so today we're going to talk about 6 ways to differentiate yourself from your competitors, and at the end of this seminar, some takeaways for you to get started and immediately start growing your referrals. The first slide that I have up here is maximum results. And the maximum results is a philosophy that we have that talks about getting yourself off of the competitive or off of the experience and luck curve and onto the competitive edge curve. Most home care companies today are on the experience and luck curve. They do things by trial, no real sure way to get to their end result. And so these 6 proven strategies we're going to share with you today are going to get you on the competitive edge curve and get you referrals faster. The first step that we want to talk about is developing a marketing plan. And we've talked about developing a marketing plan pretty much on every webinar that we've ever done. The reason why we do that is because it's the most important aspect to any marketing strategy or program that you're going to develop. And the reason why is because without a direct and clear way to your goal, you're probably never going to get there. And I've asked this question many times before on webinars is, how many of you would drive across the country without a roadmap or a GPS? And the answer is always a resounding would never do that because it takes too long, it costs too much money, and more than likely you'll probably never reach your destination. So then why would you operate your agency or your sales territory any differently? Everything starts with a one-page marketing plan. It's like having a target on the wall. And that target on the wall allows you and everyone in your organization to see exactly what your goal is for your organization. And it being the beginning of 2012, now is the time to develop that target on your wall. And that's essentially what a one-page marketing plan allows you to do, is develop that target so that everyone in your organization knows exactly what that target is and what you want to accomplish throughout that year. The reason why most agencies don't develop a marketing plan is because they overcomplicate the aspect of what a marketing plan really should be or what it needs to be. And so up here on the screen, I've put up here the one-page marketing plan template that we coach and teach all of our customers and clients. And it's a very easy way, and it demystifies essentially what a marketing plan really needs to be. 10 simple steps to develop that plan. As you'll see in the very top of the page, the first step is a summary statement. Your summary statement is essentially what is your target or what is your goal for the year. That's essentially what it is. The second step is your current market situation. And that is what's happening in your local market that is going to prevent you or help you reach that summary statement or that target that you want to reach for the year. Then step number 3 is developing your SWOT analysis, which is essentially your strengths, your weaknesses, your opportunities and threats, and your competitive and market analysis. It's doing some due diligence and analysis on your local market on what your competitors are doing, what their strengths and weaknesses are, and what your own internal strengths and weaknesses are within your own organization. And it's knowing those. Now, of course, we're not going to have time to get into those specifically and how to do a SWOT analysis today. I have included in this presentation some templates for SWOT analysis and competitive analysis. But what I want to touch upon today is that when you're developing your one-page plan, is that you understand it and do a SWOT analysis and make that part of your overall plan. Because unless you really know what the strengths and weaknesses are of your organization and of your competitors, it's really difficult to formalize a differentiating plan against your competitors. The fourth step of your marketing plan is developing a unique selling proposition. And I'm going to talk about this here in the next step, but your unique selling proposition is that single precise statement that differentiates you from your competition. And it's the most important aspect of your marketing plan. Every agency has to have a differentiator. It's that 30-second elevator statement that you had, or that you have, if you have that opportunity with a physician or a referral source, what would you tell that referral source in those 30 seconds that would differentiate you from your competitors? And I'm going to share with you some examples of that in a minute. And that's the fourth step. The fifth step is understanding and developing what your service offering is or what your niche is going to be. What are you going to be known for in the marketplace? What specialty program are you going to be known for or recognized for in your market? What services are you going to be known for that can differentiate you or be certainly a niche? An example could be an orthopedic program or a pediatric program or some of the other programs that Eric will discuss later on in the seminar today. But you've got to understand in your plan is what is your niche going to be and what are you going to be known for in that marketplace you're competing against. And then step number 6 is your target market. So once you've developed your service offering in your niche, who are you going to be targeting in your marketplace? And there's a philosophy that I often refer to as Occam's razor. And Occam's razor is the most direct route from where you are today to where you want to be. So if your niche service is going to be a cardiac program, then who should your target audience be? Should your target audience be orthopedic docs or should it be cardiac docs? And so one of the biggest challenges that agencies have today is making that target audience congruent with their overall service offering and niche. And so you've got to make sure that your sales team is congruent with your service offering and what niche you're going to be marketing and be competitive in the marketplace. Number 7, your objective. Step number 7 is very simple. Your objective is exactly the same as your summary statement. Your objective is your goal. It's that target on the wall that you and everyone in your organization should know exactly what it is that you want to hit. An example that I have up there is we want to grow revenue by 25%. We want to grow revenue by 25% in 2012. That is our goal. That is a really great agency goal, but if you're a sales rep today on this call, you'd want to break that down into a more granular level. Maybe that your goal for the year is going to be, I want to bring in 300 Medicare admits for the year, or I want to bring in 300 hours of private duty services per month, or whatever it may be. But you want to be a little more granular if you're a sales rep and developing your own goal. But the agency level needs to have a target, and so does each sales rep as well for their objective. And then step number 8 is your strategy. So how am I going to accomplish achieving my objective? What strategy am I going to put in place in order to accomplish the 25% growth in revenue or bringing in an additional 500 Medicare admits, throughout the year? How am I going to do that? And so an example I have up here is an increase in referrals from A accounts by 10% in 2012. So I want to increase my referrals from A accounts by 10% in 2012. That is a really great strategy statement, which means that I'm going to focus on my existing accounts, which is the best way and the fastest way to grow your referrals. And I'm going to increase the referrals by 10% this year. Now, it's easy to say that, but what are the tactics, which is step number 9, that I have to put in place in order to increase and get more referrals from my A accounts? Okay? So as a strategy, that is the broad idea of how I'm going to bring in referrals, but tactically, how am I going to do it? And so an example of a tactic is I'm going to educate my A accounts, those accounts that know you, like you, and trust you, that are currently referring to you, on our new specialty program or a new program that we're developing in 2012. And I'm going to educate those existing accounts on this new program and how it can improve their outcomes or reduce rehospitalization rates. And in doing so, I'm going to increase those referrals by 10%. And that's a tactic. So you may have one strategy throughout the year on what you're going to do to increase your referrals or to overall accomplish your goal, but you're going to have multiple tactics that you're going to lay out. For example, the one that I listed up here on the screen that you'll use in order to accomplish and achieve the overall strategy, to ultimately achieve the objective. And then the last step of your one-page plan is to establish a marketing budget okay? A marketing budget and a review. And it's very important is once you've established your marketing plan, the one-page plan, is that you review it at least once a month, that you pull it out, you get your core team, review your marketing plan, and make sure that you keep it, fresh and fluid. A marketing plan is only as good as how updated and how current it is. So make sure that you're reviewing that marketing plan consistently so you're getting the greatest return on your investment from your plan. I put a couple of templates in here that you'll get when you receive the webinar slides. I put a template in here for strengths and weaknesses, for your SWOT analysis, and your opportunities and threats, and your competitive analysis worksheet. Feel free to use these worksheets. If you need additional information on these, feel free to schedule a coaching call. I'll be happy to go through these sheets for you. But these are great sheets to include in your one-page plan when you're developing your SWOT analysis. Step number 2, which is also a big component of your one-page plan, is to develop that unique selling proposition. And most home care companies today have a difficult time differentiating themselves from other competitors. And when you talk to referral sources, and we've surveyed thousands of referral sources, they tell us that home care is a commodity and that home care agencies are all the same. And now we know that's not true, right? And a little chuckle there. We know that's not true, but in the mind of the referral source or the community or the patients or their loved ones, it is true. And so how do we differentiate from our competitors? The best way to do it is to develop a unique selling proposition statement. A unique selling proposition statement, which is essentially one sentence or one paragraph long that anybody in your organization, not just the sales reps, but anybody in administration, clinical, anybody in your organization, admin staff, could answer that question if they were posed that question by a referral source or a community member of why they should refer to your agency and not a competing agency. I've listed up here 8 bullet points. And a lot of times it takes 2 days, a day, a week, a month at our workshops here at TAG to develop a unique selling proposition. It's not an easy tactic to do, but once you develop your unique selling proposition, it really becomes a great differentiator for you and your organization. And so I've listed up eight areas up here that you can think about over the coming days and what your unique selling proposition should be. Okay? And I'm not going to go into each one today, but these are areas that you can be thinking about. Number 1 is your specialty program. What specialty programs have you developed or could you develop, okay, based on doing some of your market analysis that could give you the greatest differentiator? Maybe looking at some of your outcome reports that could maybe hone your way into where you're better at than your competitors in these specialty programs. Then moving into the next one is your service area, your coverage area. Maybe you have a unique coverage area, a large service area that is larger than any of your competitors. That could be a unique selling proposition for you. Third bullet, your outcomes, your quality scores, HCAP scores, customer service scores, anything like that is quantifiable that you can release out to the marketplace or to referral sources that can clearly differentiate you. It's amazing how many agencies that we work with here, and we identify that they have great outcome scores, but yet aren't marketing those and using those as differentiators from their competitors. Next one is your size. Are you the largest? Are you the smallest? It could be an advantage to being either or. Your intake process. This is a huge differentiator in the market today. When you interview and you talk to some of your referral sources, those agencies that can develop and provide the easiest intake process, maybe it's one call does it all, or you can take the referral, and if you cannot service the referral, you'll facilitate it out to a strategic partner. But the idea is you've made your intake process very easy for the consumer and the referral source so that you've streamlined that process for them. And that's another avenue that you could go with your unique selling proposition. Looking at some of your existing clinical staff that you may have in your organization that have certain credentialing or certifications that your competitors don't have that you could market. Your hours of operation. Most of your competitors today have 8 to 5 or 9 to 5 hours. Look at extending those hours with a live intake person, not just an answering service, but looking at extending those to 24/7 or having extended hours in the evening where you can do that live intake and take that referral 24/7 hours a day. And then technology. Technology is another big one today. Looking at what technology do you have in your organization that is different and more competing than your existing competitors. And some examples are telemonitoring programs, Zoe Monitor, Anodyne, and go on and on and on, patient physician portals. there's a lot of technology out there in the marketplace today that maybe you have that your competitors don't have that you could use as a unique selling proposition. So the idea is that you hone in on one of these areas that is a unique selling proposition for you that your competitors currently don't have or not offering, and develop a unique selling proposition around it so that everyone in your organization uses that as a talking point when they're selling your services and differentiating in the marketplace. And part of, in the final conclusion of developing a unique selling proposition, is answering this question. This will really help you develop that unique selling proposition statement. And it's this. Most agencies or most competitors in my service area, okay, provide or offer blank. But what we offer and what's different about our organization is this, or blank. And so by answering this question, this is going to really help you develop that unique selling proposition. And once you've developed that and you've answered this question, you want to ask yourself this: can my competitors say the exact same thing, or are they currently offering the exact same thing? And if the answer is yes, then you want to go back and revise it or redevelop that unique selling proposition so that it's different or more differentiating than your competition. Okay. So I'm going to pass it over to Eric for Surefire step number 3.
Hello everyone, this is Eric Crump. Thank you for attending today's webinar. You'll notice right away I don't talk as fast as Adam does, but I preach a little harder, so hold on to something real steady. I'm going to take you on a ride here. What we find with most home care agencies is some of the basics are missing. We go into a home care agency, there's not enough accountability, not enough transparency, not enough scheduling to be effective. So what we're going to do today, first thing, is make sure that you guys realize that the basics have to be covered if you're going to be effective. Now, one of the major oddities of home care is that we're in a very highly competitive market. Like Adam said, we're a commodity now, and we have a lot of competition. However, most home care sales teams are overseen by clinicians, people who are used to delivering service to the benefit of their patients or their clients. So accountability is a big issue in home care sales teams. So I want to challenge you guys to look at these next 2 or 3 screens and do some soul searching inside your agencies and make sure that everybody is directed, because selling home care services is very different than delivering home care services. So if we can make that point. Your concentration and emphasis has always been on the service delivery side of your business, and going after new business for our agencies has often been a struggle. However, I will tell you, you cannot sustain your current patient census, whether you're in private duty, hospice, or home care, without a very robust and concentrated sales team. Usually the first agencies in a local service market area that embraces true sales techniques and philosophy will benefit from the lion's share of the market. And we see that happening in all the different markets we serve across the country. It's as if the top 10% of all sales reps are getting now 50% of the business, only because they know sales technique and they know how to paint the picture of benefit. So I want you guys today to commit to some basics. I want you to commit to developing a productivity model whereby each of your representatives call on at least 40 referral sources, 40 referral areas where you have some potential of getting business. Now that doesn't sound like a lot until you're out there applying it on a daily basis. This is a lot of contact, but you need this much contact because this is an opportunity sale. In other words, your referral sources are not thinking about home care services, private duty services, hospice, 24 hours a day. They're thinking about their acute care providing or chronic condition management. We have to draw the picture when we're there and stay top of mind. Therefore, we have to have our sales reps having exposure to these top referral sources in our territory. One of the biggest mistakes home care agencies make is they spread themselves too thin. They don't concentrate their message, and therefore it has no value to their referral sources. I want you to invest in some strategy. Guys, we're going to show you a couple of pieces today. TAG has 48 new training hours just based on developing strategies relative to your specific service market. So there's going to be some offers at the end. I just want to challenge you guys, make some strategy, paint the picture, deliver something that the competition's not doing. The competition is delivering the donuts and the bagels. They are offering to do the training sessions for CEUs. They are buying them the lunch that goes nowhere. I want you guys to look outside the box, see what the needs are of these referral sources, and develop strategy around the needs. A successful formula for all sales reps is contacts, agenda, strategy, and close. So in contacts, you've got to load up the ones that have the potential to give you business. Too often we're just following a roadmap. You may as well be delivering newspapers or milk. You've got to call on the referral sources that mean something in your territory, not just call on a number. Agenda is in Adam's 10-step, one-page marketing plan. That would be one of the objectives. So your agenda, your overall objective is to take this referral source, and in the 8 weeks that I'm going to call on them and concentrate my message, here's what I want to be the outcome. And then we talked a little bit about strategy. It has to make sense. You've got to be able to present a strategy and put in your strategy one or two things that the referral sources don't hear on a daily basis. If you're sounding just like your competition on every sales call, you're going to be in that lot of the also-rans. You're going to be in the bottom 50%, and you're going to get the mercy referrals. However, if you can bring up things like the new medical nutritional therapy benefits or annual wellness visits or the new CMS demonstration models, if you can work some new talking points into your sales strategy, you're going to go very, very far with these referral sources. I always tell sales reps, you have to introduce one thing they don't already know to get their attention. Otherwise, you're going to just be sounding like everybody else. And a close. I would say most reps in home care try to close too quickly. They have not won over their referral sources. They don't have enough benefit present to justify a close. And one of the great shutdown statements you'll ever hear on a sales call is, we're going to give you the next referral. That's the quickest way to get you guys out the door, and you leave happy, everybody's happy. That referral never comes. So if you haven't shown them the benefit and you're not worthy of the close, then don't expect the business. 40 pace visits a week, every week, is hard work. The secret is not reinventing the wheel with each visit. In other words, you're going to have a delineated conversation with a specific referral source. I always draw the analogy of having 40 referral accounts in a territory is like playing chess in a park with 40 opponents. And each visit is you're getting up out of your chair and you're going to the next chessboard, because every referral source is unique, their needs are unique, their payer sources are unique, their opinions are unique, and remember, they're always the expert, we're not. So playing those different games at the 40 different referral sources is what is magical about turning the referral source into a benefit message as opposed to just begging for the business. So I want to stress the fact that you guys need some type of tracking mechanism, and if you have management in your sales team, they need to see a storyline from these call visits. It can't be that they introduced our services, asked for a referral on every one of their notes that are in your contact manager. You need a strategy, stick to the strategy. If it's not working, change it. Otherwise, you're going to suffer from market fatigue. So contact with physicians and clinicians, often brief, and from their perspective, unexpected. You're interrupting their day, right? So we must first use proven sales technique and lead them into thinking about our desired talking points. Too often we show up with a value message and our target customers are not prepared to understand it, right? We call it rapid fire demonstration, or showing up and throwing up. We haven't set the table for our discussion, to wit, it's not going to be understood. So you have to have your value message well defined. This is your unique selling proposition. It has to be no more than 2 or 3 sentences, and it has to state your agency's value message, or you'll just lose your client. Their eyes will glaze over, they'll turn around, they'll get on with their day. So allow your referral source to be the expert and allow them to reflect on your initial benefit statement, what you're throwing out there that you can do. One of the hardest things to do on a sales call is keep your mouth shut and listen. However, that's the next step. Once we have challenged them with a statement that they didn't know or a benefit that we can do, it's up to them to move the ball in the next step. We can't talk our way into a sale or into the delivery of services to one of their patients. So resist the urge to rapid fire demonstrate simply because you have an opening. And we see that all the time. Now, I want to talk about a specific strategy. So this is the fourth in your benefit of the 6 today. I want you to do your SWOT analysis based on some really definite data. And one of the best ways you can look at definite data, and everybody has access to it, is Medicare.gov, right? So a powerful sales technique in home care sales is to paint the picture of how and why a referral source's patient or loved one would benefit more from your services than your competitor's services, okay? So when you're profiling or doing your SWOT analysis for your local competing agencies, it's very important to stay on point, stay focused. You should profile the preferred providers of your major referral sources within your territory. And I always say, don't waste time reaching down. If you have a specific market share and there's 3 or 4 agencies above you, that's your target. You're never going to reach down and try to sell yourself against people who don't have the census that you have. So always reach up, not down. There's little benefit in selling against competitors beneath you in the referral food chain. For private duty services, it's important to create the SWOT analysis. You have to put down there the services, service area, price, specialty programs or services, and employee profiles. And each one of these unique qualities, you need to have a benefit statement associated to those, because the talking points should be led by your clients, potential clients, loved ones, referral sources. And when they bring up the opening, I use the analogy of sharpening your arrows, keeping them in your quiver, but don't just shoot in the dark. Wait till they hold up a target. So your initial job is to get them to reveal a target, and then have the arrow already sharpened and ready to fire on one of your strong points. With skilled home health services, it's pretty easy. We need to start doing a better job of differentiating our services. It's like Adam said. He talked about us being seen as a commodity. There's no differentiation in our referral sources' minds. I'm telling you, you can draw a picture of differentiation, and you can take it to 2 or 3 levels deep until it makes sense to a clinician. All home care agencies, including your own, currently report 22 different quality outcomes on Medicare.gov. Go to that site, learn it, learn your outcomes, have statements of benefit or explanation about your outcomes, and likewise, look at the ones that you're trying to get the business from, the profit share or the patient share in your local area. On the website Medicare.gov, we're compared to the national state averages of all 22 quality measures. So we teach a course just on how to look up different things on Medicare.gov pertaining to home health agencies. There's a lot of information there. There's services provided. That may be a unique selling proposition with one of your major competitors don't provide social workers, medical social workers, or speech therapy. There's a ton of information you can find out and create your SWOT analysis. So you would go to the home page, hit Home Health Compare, and then profiling your competition, you want to make a valid case for continuous referrals being awarded to your agency. So we must show that we have clinical or care differentiators as well as how we achieve them. So we have to show our work. I always say if you're going to talk to a clinician or a physician, you always want to introduce your services with discovery, action, outcome. Here's what we see, so here's what we did about it, and here's the benefit to you and your patient population. If you don't finish that sales point of here's your expected benefit, do not expect them to see the differentiation you're trying to draw. So you're going to draw the complete picture on how we arrive at our results. We must also be able to relay to our clients how we maintain superior outcomes and deliver superior benefit. In other words, we have to show them how it's a continuous operation. And when we get into profiling hospitals, you'll see why that's important. They have to repeat their results over and over in their new efficiency model of value-based purchasing. So quality of patient care, one of the big ones, and each one of these is a header. That's where the 22 outcomes come in. Preventing unplanned hospital care, you can see there's agencies up there. Some of them are very good, and some of them not so good. But you can make your value statement based on either your competitor or the state or national average. And that's how you derive at your initial benefits statement. You can and should learn about your competitors' clinical outcomes on Medicare.gov. In cases where we're notably better or worse, knowledge is power. There's nothing will blow a salesperson up out of the water is to show up and ask for a patient profile and your agency's outcomes don't warrant it. And a clinician simply says, I use people with better outcomes. If you have not prepped your sales team on how to overcome those objections, don't expect any business for a long, long time if you get caught in that trap. So you need to learn how to overcome objections to your service and also be prepared to draw distinctions between your agency and other agencies on a number of measures. I mean, this is the tip of the iceberg, guys. Like all information dealing with the care of others, use talking points judiciously. They shouldn't be used in context of better care. You know, you're not winning a race. This is all about the development of a care program. If there's not significant differences, except the fact that outcomes change that are posted, and you don't want the flip argument put on you in the next 8-week productivity model. So you could, again, differentiate yourself on services. So you can see there's 4 different agencies up there. One doesn't do speech, one doesn't do medical social services. So knowledge is power when you're taking on one of your major competitors. My suggestion is to create a matrix of favorable clinical outcomes and keep them in your sales binders as evidence for demonstration and validation benefits. Now, if you were to come to TAG, first of all, you'd have a great time. You'd learn a lot of stuff. But one of the benefits is you would leave with a sales binder. You would leave with a specific plan of action and the specific tools on how to make your point to your individual referral source territory. And remember, Medicare.gov information is seen as the industry standard with clinical referral sources because their clinical outcomes are posted up there as well. I'm going to turn it back over to Adam for number 5.
If your agency today, your sales team, sales management team, is not using a robust CRM, then you're clearly at a disadvantage. The industry has become so competitive, as we all know, and when your competitors are using a CRM or some type of a contact manager to sell to referral sources, then they're clearly at an advantage over your organization. Some of you today are using a CRM, maybe not using a CRM to the level of what I'm going to talk about here today. Some of you maybe are using a CRM to the level of what I'm going to be talking about. But at the end of the day, you've got to be taking a look at what are the activities that my sales reps are doing, and are they being measured, and is there that clear transparency of what they're doing, and are we getting the results from what they're doing? And there's some other tools that we've developed within our CRM that I want to share with you today. What are some of the benefits of a CRM? Well, the CRM today allows you to have more focus on your overall sales strategies, where that sales strategy is agency-wide, as opposed to one rep doing and sharing or having a best practice in his or her market and another rep doing another best practice in their market. A CRM, or the one I'm going to share with you here now, allows you to share and have that transparency company-wide, multiple markets, multiple agencies that allow you to share best practices and sales strategies across the entire company, which allows you then to be able to maximize that sales and marketing ROI. The acquisition cost today of a client or referral source is extremely high. And so how can we reduce that acquisition cost? Well, one way to do it is to streamline your sales and marketing process through a CRM, through sharing best practices. And allows you to have those sales efficiencies that don't exist when you don't automate the sales process. And by doing that, by increasing your efficiencies and having full transparency, you're able to make better decisions about what you're doing and the money that you're allocating to your sales and marketing efforts, which ultimately allow you to increase market share. And I'm going to share a slide with you in a minute that allows you to identify, opportunities that you didn't know that existed before, both from facility and physicians. And so a couple of years ago, 3 years ago now, I looked into some of the competing CRMs that were out there in the marketplace, some of the non-vertical CRMs, Salesforce, and some of these ones that weren't market specific. And then looked at some of the ones that were more specific to healthcare. But there wasn't anything that was specific to our industry. So then we developed our own, and it's called Playmaker. And for those of you who are on this call that are using Playmaker today, you know what I'm talking about as far as the robustness of the application, how it allows you to streamline and become more sales efficient. But what also it's allowed you to do today, and we've added some functionality to it, is to identifying that low-hanging fruit. Those referral sources, physicians and facilities that aren't currently referring to you today, but that could be, that have low utilization of home care. These referral sources, this low-hanging fruit that we were never exposed to or couldn't identify before because we didn't know that they existed. And so what we've been able to build into Playmaker CRM is specific functionality that provides you with targeted heat maps that you can look at a specific region or area within your service area and identify this low-hanging fruit. Maybe it's a physician, for example. This physician that possibly is not referring to you today, but is referring a ton of additional home health or hospice or private duty referrals to your competing agencies. And through Target Watch, you can go in there and identify, these opportunities that you weren't aware of before, that you didn't know that existed. This functionality allows you to identify volumes and ratings and decile rankings of physicians and facilities and give you a clear idea so when you're developing your overall marketing plan of where you should be spending your time. See, most reps today, they don't spend their time wisely. When you look at an average day of a sales rep, in an 8-hour day, a rep has on average 3 to 3.5 hours of face-to-face time. And the other time is wasted. The other time is wasted through reporting, through trying to identify opportunities, spending months, sometimes in some cases years, identifying opportunities that may never be able to get in the door. Didn't know strategically how to sell to these referral sources. And so through this data and this application, now we're able to essentially revolutionize in where your reps should be spending their time and where sales managers should be spending and routing sales reps day to day. So that investment that you've made in your overall sales and marketing program, now you've been able to quantify and identify what your true ROI is. It's never been able to be done before. And so through this application, we've now been able to provide a tool to you and to your sales reps to be able to identify opportunities and action and monitor on that. In addition to that, there's never been an opportunity before to really look at and share that transparency agency-wide of this type of opportunity as far as targets and opportunities and be able to measure, on that. And this allows you to do that. In addition to that, it's never been as important today than to be able to identify contact and account profiling, to be able to understand what the needs and the greatest interests and objectives are for your referral sources that you're selling to. It's difficult when you're selling to multiple touch points in our industry where you're selling to facilities and physicians and different community venues and so on to develop clear strategies that you can remember and that you can action on real time. And so there's never been a better time in today's marketplace with the cuts and the demand on increasing the efficiencies from your overall sales program to automate it and to give your sales reps and your managers the tools to be able to action on and get the greatest results from their time and their efforts. Some of the other benefits of having a CRM in your organization is a compliance auditing tool where you're able to take a look at what your sales team is spending on each account and each contact and measure those and control those. As we know, there's going to be some reporting that CMS is going to be requiring here fairly soon. It's happening with the medical equipment industry where they're having to report annual reports to Medicare on the amount of money being spent on physicians and facilities. And so compliance tool, expense tool, we know that it's a lot of time. I talked about that 8-hour day for a sales rep. A lot of that time gets eaten up by producing expense reports and tracking expenses and so on. In this tool, we've been able to develop automated expense tracking where reps can do it literally with a one-touch click. Sales and marketing reporting, be able to provide real-time sales and marketing reporting so you can make better decisions on how to market to a referral source and where you should be spending your time. Sales zones. I talked about those best practices. We have built-in sales zone functionality where you can develop your own sales zones and best practices into the application so that you have these best practices that are being shared company-wide by the entire sales team. So if there's one particular sales technique that's working in your organization, you can share it with every single rep and build it into the sales techniques and profiling organization for the organization and much more. And so if you're currently not using a CRM today, I certainly want you to consider that because it's going to allow you to be able to quantify what your sales team is doing and make better decisions real time. And just think about the opportunity if you had a tool like that, how much more competitive you'd be over your competitors that don't have one. And the time is now to action on that. It's going to give you a huge differentiator in 2012 and make your sales team much more efficient.
Hey guys, it's Eric again. This is a great webinar, huh? I'm going to take you guys on a journey now that probably should take 2 hours, but I'm going to get done in 10 minutes. I just want to tell you, as Adam said, the opportunity has never been greater. All the cutbacks in all of healthcare, CMS has put over in a bucket for preventative services and demonstrations of money-saving opportunities. So there are a ton of CMS demonstrations you guys could get involved in. I will tell you some of your competitors are getting involved in. And if you're still marketing with the mindset that you had 2 to 3 years ago, you're certainly missing the boat. Because it's just not us and our regulations and reimbursements that are changing. Medicare and CMS are changing reimbursements in every one of your referral sources. So we're talking about one referral source in particular today. I want to shift the focus to one of our referral partners, and sort of the holy grail of marketing is to get to the hospital discharge planners, and they have built such a gauntlet of contact that some of our reps have given up on hospitals. I see it all the time. I will tell you again, all you have to do is introduce benefit and tell them something they already know about how home care can save them time, money, or have a better patient care model, and you can get their business. And I can give you specific examples in the contact screen. You give me a call. So I want to go back to Medicare.gov, and I want to tell you that now we're comparing hospitals because of the information that's loaded up about home care agencies. There's probably 5 to 7 times that much information loaded up about our area hospitals. And now I'm going to show you how to develop some strategy based on the information that's available to you right now. You could log on right now and look. Profiling hospitals. Once your local service area hospital compare site, once you're there, you can begin to find out a host of information. You can find out how many Medicare payer acute hospitals you have in your area. You can modify your results to add or subtract, but you can narrow it down to target the hospitals in the greatest need. I want you to begin to compare Medicare reported outcome information. It's very important, and you'll see why in a couple of screens. Begin with a natural delineation based on your opportunity to receive Medicare home health referrals from their discharge units. In other words, you can see patient populations with certain patient diagnoses, and in hospitals it'll be DRGs. You can see how many in a 1-year period they're discharging. So then you got some specific data to go after the high volume target. You need to know all about the hospitals and see their reporting outcomes in your service area. And you'll see, knowing a little bit about how they make their money, the changes that are happening inside their bubble by Medicare and driven by CMS will make a world of difference. So you can compare any 3 at a time. You'll be redirected to their HCAP scores. HCAP scores have always been important to hospitals. It's always been 30% of their reimbursement percentage from Medicare. The rest of it was process of care. The internal acute care episode is how they're reimbursed. How well are they doing during the acute care episode? All that's going to change, but right now, 30%, and is why hospitals are so obsessed with HCAP scores. One of the best sales calls I ever made to a hospital was I asked for their HCAP discharge questionnaire. And I told them that our home health nurses would reinforce that during our 60-day initial care episode. They were blown away. They gave me so much information. I gave it to our clinical staff. They shared it with them, and my census from particular hospitals doubled. The referrals went up. So any category of assistance with reporting criteria to HCAPs is an easy thing to do. There it is. There's the landing page of Hospital Compare. It takes you to their HCAP scores. They're scored on 11 different questions right now. What I want you to do is, to the left, you'll see those different blocks are different search engines. We're going to go down from process of care measures, and then profiling hospitals. I want you to keep in mind, process of care measures is very important to them now, because it's how they care for their acute care patients during the acute care episode within the hospital. But based on value-based purchasing being enacted on October 1st, 2013, their whole payer source is going to change. It's like us going from pay-for-service to episodic reimbursement, PPS. Theirs is just called VBP. They're going to have the same dramatic effect in their world. And it's coming October 1st, 2013. They're no longer going to be based 70% on process of care and 30% on their HCAPs. It's going to be divided up in the clinical process of care, patient care experience, patient outcomes, and efficiency. So we're going to go over that in a second. The new proposed value-based purchasing that's going to happen to the hospitals, we can affect as a home health provider, as a private duty provider. We can help some of these scorings, and they're in a panic mode. If you see on the left on the screen of process of care, currently they're in control, and most of them are at 99 or 100% on all their process of care measures, because it's how they make their money, and their HCAP scores. Starting October 1st, which is fiscal year 2014, October 1st, 2013, their payer mix is changing. Now, think about it from our perspective. When our payer mix changed, how many home health agencies went out of business? How it affected our productivity model, how we had to reinvent ourselves. The hospitals are there now, and they're scared to death. But if you can reach out to them and say, listen, we can help you with these outcome measures. We can help you with the readmission rates, and here's how we'll do it. We can help you with the efficiency model, because we can deliver the post-acute care episode efficiencies that is a major way that you'll be graded from now on. In other words, the 30% and 20% that is cut away from the process of care measures, home health is a big player in half of the hospital's reimbursement from Medicare from this point, October 1st, 2013 forward. I just want to emphasize that you guys have a great opportunity to reach out to the hospital. So you can look at their hospital readmission rates. That's one of the outcome of measures that's going to represent 30% of their reimbursement. You have some problem areas. Advocate Christ Hospital in Oaklawn, Illinois, see how they're worse than the national average in both pneumonia and heart attack patients. Do you think they would turn away a home care agency who had a robust prevention and readmission strategy for post-heart attack or pneumonia? Of course not, because you're making them money. And I'm not talking donut money, right? I'm not talking about the heart-shaped Krispy Kremes. I'm talking about hundreds of thousands of dollars a year. And not only is it hundreds of thousands of dollars a year, but Medicare's put up enough information for you to calculate it per hospital. So you can start with heart attack, heart failure, and pneumonia. Target those hospitals that really need your assistance right now. Then take a look at the CMS demonstration sites and see how CMS and Medicare will actually pay for us to develop these prevention and readmission strategies and have a win-win situation. Have a permanent pipeline of referrals coming to your agency. You have that opportunity right now. But the bad news is, so does every competitor in your market. So you can go and look at their readmission rate. I always suggest you view the graphs. There's a lot of information there. You can see anybody listed in red on the outcomes is automatically in the bottom 25% quartile. They're targeted for a quick outcome-based quality initiative program, or they're going to be put out of business. And to the right, you can see the actual patient population. So you can actually calculate the amount of readmissions. You can also see who's listed as worse or in the bottom bad boy list. And you can also see that extra quality initiatives would be required, mandated to those in the bottom 25% quartile. They would have to come up with their own outcome-based quality initiative if you didn't knock on the door with one already. So, I just want to tell you this. The money paid per DRG is uploaded on Medicare.gov. I can actually walk you through a calculation and show you in a one-year span how much your local hospital lost for certain diagnosis. I'll give you a hint. CHF, CMS, Medicare estimates that the cost of care for a CHF patient is $9,600 in acute care settings. That's a readmitted patient with CHF. Their actual reimbursement is around $6,400. You could arrive with a prevention and readmission program without any stipulations on penalties or change in reimbursement and tell them and make the case where you can save them $3,200 on every readmitted CHF patient. That's how specific you can be in your talking points. So we kind of took you on a journey today, and it was very quick, but I just want to reiterate, this is the tip of the iceberg, but this is a peek into the new 48 hours worth of training that we have available here at TAG to put your sales team on a different avenue. So I want to close by giving you offers from this webinar. There's 6 surefire ways to jumpstart your agency's revenue in 2012. Remember, you have your one-page marketing plan. If you need assistance with that, contact us. Our contact page information is going to be up on the screen in just a second. Develop your unique selling proposition. Remember, if you're not approaching your referral sources with initial benefit statements, you'll sound just like everybody else. They don't want to hear you. They don't have time to hear you. I want to work with your sales team just to nail down a good foundation of business for you. Make sure you're getting your money's worth out of the efforts that you're putting in. I realize most of us are clinicians and we're worried about patient care models. You need to start worrying about where you're bleeding money in your sales force. I can teach you easily how to profile your competition. If you were to have a robust CRM like Playmaker, then it would pay for itself many times over. And we can show you that. And profiling hospitals is tip the iceberg. I've got so much more to share with you on profiling hospitals, but we can also profile long-term care centers and other areas too.
Okay, thanks, Eric. So don't get off yet, because I've got a great offer for you, and I want to share with you how you can get these slides and that free report that we promised you, Power Strategies report, here in a minute or two. I want to share with you an offer that we've never done before, and I want you to now take a minute and just envision having 2012 be the best year for your agency, the absolute best year as far as referrals, sales efficiencies, and overall success. You know, Eric's talked about the 48 hours that we've developed. We've been doing for the last 5 years, boot camps both on-site and here at our facility. We spent the last 6 months developing our new Home Care Sales Mastery University, which includes 3 days, 2 days here in our 20,000 square foot facility with an optional 3rd day. You're going to learn best practice strategies above and beyond what we learned here today, 3 days of it. Physician and facility selling strategies, community marketing sales techniques, outcome and specialty programs, transition care, community-based organization sales strategies, territory and account management, and just a ton more. And so the idea here is that when you come in here for the 2 days with the 3rd bonus day, that you leave here being the best possible sales rep you can be in your territory. If you're a sales manager, coming here and learning new sales management techniques as well. And so we package this program so that we're going to provide you with the best overall best practices for home care sales marketing techniques that have ever been created and ever been developed. And we're going to stand behind that. In addition to the home care sales training, we're also going to provide you with Playmaker CRM, loaded on a brand new tablet. And the tablet is going to be a tablet PC with Playmaker CRM loaded on there. We're going to have part of the 3 days of you being here on site. We're going to train you how to use the tablet. We're going to provide that annual support for Playmaker so your reps can call in here and get the additional support. We're also going to provide you with an annual membership to our new online university, which gives weekly and monthly sales and marketing strategies with hundreds and hundreds of templates to use. So it's not just a matter of coming here after the 3 days and then leaving and not having that support. We're going to give you that ongoing support daily through the online university. It's a great way to get new strategies, keeping the sales team fresh and ideas, and then also providing with a free monthly 60-minute group coaching call where we're going to give you additional strategies and support you and answer questions on what's happening in your particular market and how to get best practices within your service area. Our 2012 brand new Power Play sales manual you'll also get. And so we believe we put together the best complete overall sales and marketing training in one place. And we have 2 dates, and these are the only 2 dates that we're going to have, February 15th through 17th and February 22nd through the 24th. Once again, they're going to be here in Nashville, Tennessee, beautiful city of Nashville, on these 2 dates at our 20,000 square foot training facility. And I have a price up here of $14.99 per attendee. And then, of course, that's plus your monthly Playmaker CRM fee. And we only have 10 spots for each event. And out of the 300 people plus on this call today, I will tell you, based on our experience, that those 10 slots per event will be gone probably by the end of the day today. But if you want this to be the best possible year for your agency or for you as a sales rep and blow your numbers out of the water and make financially the best, most prosperous year you've ever had, then I encourage you to come to the Sales Mastery University. It's the best program we've ever put together. I'm very confident that when you leave here, I'll actually guarantee that if you don't leave here and after 60 days, increase your referrals and we'll give you a full refund back. But I'm very confident and know this will be the best opportunity and best investment you'll ever make in your overall sales team and sales program. How can you do it? There's a number up on the screen, 866-232-6477. Call into that number, talk to either Nick or Reba, and they'll make sure they get your spot reserved for the Sales Marketing Mastery. Okay, so that's the offer. As far as getting the slides, Nick will send an email off to all the attendees today. Tomorrow, all the attendees, and that will be included with the slides as well as your free report, your Sales and Marketing Power Strategies report. And you'll receive that tomorrow via email. So that concludes our webinar for today. I'll ask Nick here if there's any questions. I'd be happy to answer any questions that we may have.
Adam, we have a question. Do you have productivity levels for hospital liaisons and staff in the intake department? We can show you, based on DRG, what the annual discharges is of direct Medicare patients. That information is available. But more than that, we can show you how to put up a productivity model for your individual sales reps that makes sense, where they're calling on the major targets, not leaving them out of the mix. We have some other congratulations about the webinar from friends of ours, some questions about cost. I encourage you guys to write down these contact information and telephone numbers. Contact either Adam and I directly or call into the 1-866-232-6477 number. Ask for Nick or Reba, and we'll answer all your questions there. Anyone who attended today's webinar, to get started, we always offer a free 30-minute coaching call. If that's what you want to do, call in and schedule that. I always promise webinars that I attend and help deliver that I'll answer those personally. So we'll talk about anything that you would like to go down at a deeper level. We've got some questions about specifics of the slides that Adam had up. We are going to put out those slides, and you'll be emailed to a connection on the web where you can link to the slides. However, if you would like the templates sent to you as an attachment, contact us, email us, and we'll do that for you as well. And we have a question: how do you acquire a CRM? CRMs aren't rocket science. However, they're one of the most integrated parts of your sales team. All you got to do is call in, and we have a separate number for that if you want to write it down. It's 866-930-6847. However, anyone on the TAG Home Care Support Team can give you that number as well. So I want to give you the CRM only telephone number to call in, 1-866-930-6847. Yes, you can jump CRMs. We can show you benefits of why you would want to use Playmaker CRM. Playmaker CRM is the most robust in the industry. It's got the specific targeting data, but also you have the experience of real-world home care sales coaches in support. I challenge you to find another CRM with people who's actually been told no by a physician angrily and had to leave. You'll only get that through Playmaker CRM. How do you deal with hospital-based home care competition? Great question. I was actually in Chicago a couple of months ago, had a great conversation with their administrator. It was a Catholic Charities church. She was telling me that they had their own home health, and I showed her where the home care agency I was representing could save thousands of dollars per readmit, and compared their internal readmission numbers to what historically the home care agency I was representing readmission numbers were. And I told her she was sacrificing $3,200 per readmission for the benefit of getting $500 profit on a home health episode. She quickly signed us up for that one DRG. So that goes into a little bit of the conversation of you can't show up and ask for the entire pie. You're going to have to ask for a piece at a time. You're going to have a reason on why you deserve it. But that was a great question. I'd love to schedule a coaching call and follow that in more depth. Got a lot of thank yous. Guys, we appreciate the care that you provide to your audience and your patients and clients out there. We're here for you. All you got to do is contact us. We'd love to talk to you about any of these issues you're bringing up. And we have several more questions coming in. We're going to answer each one offline, and we're going to leave up our contact information. Right, there's only 20 spots, and 4 of them, Nick just put his thumbs up, are gone right now. So those camps are selling out. They will sell out pretty quick. We'd love to have you in here. Like Adam said, it's no risk. You come in here. If we don't turn you around and turn your sales team around, nothing ventured, nothing gained. So we're going to end it here. Thank you guys for attending. There's a good bunch of you on the call today. But we'll follow up. Give us at least till lunch tomorrow to answer all the questions. But schedule your coaching calls today. Get in the pipeline, and we'd love to service you. Again, we represent TAG Home Care Marketing right here in Nashville, Tennessee. We love servicing the industry. And we're going to leave the contact information up here for about the next 30 seconds. And we want you guys to have a great day. Thanks.